All right, my name is Haley Thompson. This is gonna be my head to toe. This is my paper. Okay. Hand hygiene. All right, hello. My name is Haley. How are you today?
I'm good. How are you?
Good. I'm gonna be doing your head to toe today, if that's okay.
Yes.
So first off, I'm gonna start off. Can I get your name and date of birth?
Yes, my name is Elizabeth Berg, and my date of birth is June 20th of 2003.
Perfect. And do you know where we are right now?
We are in Haley's apartment.
And do you know who the current president is?
Joe Biden.
Perfect. And so I'm just gonna start with a little bit of a health history because you're ANO ×3, so good to go today.
Perfect.
And then so after your health history, then I'll do your head to toe.
Okay.
So, do you have any medical diagnoses or any surgical history that I need to know about?
Just endometriosis, which I recently had a surgery for.
Okay. Are you recovering well from that?
Yes, I am.
Okay, good. Do you take any medications or any supplements or anything like that?
No really supplements or anything. I do take birth control though.
Okay, and you're tolerating that pretty well?
Yes, I am.
Okay. Do you have any allergies?
Just to latex.
Okay, and we won't be using any latex today. So
Perfect.
I guess there.
Perfect.
And do you have any smoking history, any vaping or anything like that?
No.
Okay, how about drinking? Any drinking history?
No.
Okay, and then diet and exercise. Do you have a pretty good diet? Like don't skip any meals, good calorie intake?
Yeah, I try my best.
Staying pretty hydrated and stuff as
Yes,
well.
of course.
And then you exercise, good activity tolerance.
Yeah.
Okay.
Yep.
Perfect. So everything sounds good there.
Okay.
And I'm just gonna get started with some vitals, if that's cool.
Sure.
Do you have a preference which arm?
No, either one is fine.
Start over here.
Okay.
And put this on your arm.
Sure.
That should be good there. Okay. Get untangled first. And then I'll clip this up here. Right. I'm just gonna feel for your brachial pulse real quick. Okay. Okay. All right, and your blood pressure was a 104/80 today, so that is good, nice and healthy.
Perfect.
And after I take this off, I'm going to get your pulse.
Okay.
Okay, I'm just gonna set this over here. And then, so I'm gonna take your pulse for a full minute.
Okay.
Just gonna feel here. Alright, and put your arm back down.
Okay.
So your pulse today was 94 in regular, so that's good. And your respirations was 12, so they're both normal.
Okay.
And then I'm gonna get a quick temperature on you.
Sure.
Okay, I'm just gonna place this under your tongue and hold it for me.
Okay.
Until it beeps. Alright. And your temperature was 99 today, so it's pretty good.
Okay.
So next I would look at your pulse. I would use a pulse ox to look at your oxygen saturation in your fingers. But since I don't have that, I will look for clubbing and I will look at your capillary refill in your hands.
Okay.
So I don't see any signs of clubbing, so that looks good. And check for capillary refill. And that is less than 3 seconds and pretty symmetrical, so that is good.
Okay.
I'm gonna start off with your arms before I get started on the head, okay?
Sure.
So I'm gonna feel for your skin. Your temperature is nice and good. Seems pretty even on both sides. Inspecting the skin looks good. I don't see any abnormalities or anything. Freckles and stuff looks good. I'm gonna feel for your muscle tone as well.
Okay.
And that looks pretty even across both sides. And I'm going to feel for symmetry in your pulses. So I'm gonna have you flip your hands this way.
Yep.
I'm gonna feel your radial pulses, and those are nice and symmetrical. And then I'll feel your brachial pulses. All right, and those are pretty symmetrical as well. So that looks good. While I'm here, I'm gonna do some cerebellar function real quick.
Sure.
So can I have you make an OK sign?
Yes.
And then I'll have you switch fingers, and then do that as fast as you can. Perfect. And then put your hands on your lap.
Okay.
And then flip them over, and go do that as fast as you can. All right, and that looks good as well. So your cerebellar function looks good.
Perfect.
So now I'm gonna start at your head. Okay, I'm gonna look at your scalp if that's okay. I don't see any abnormalities, no dryness, nothing. Do you dye your hair at all?
I do, yeah.
And that goes pretty well for you.
Yeah, just occasionally, not super
Yeah.
regular.
Right, so your hair looks good today. Your scalp looks good. I don't see any excessive dryness or anything like that.
Perfect.
So that looks good. So your face looks nice and good. The color is good. I like the freckles.
Thank you.
Pigment looks good, stuff like that. So that looks good. And so I'm gonna feel your frontal sinuses. Any pain or tenderness here?
No.
Okay, and then your maxillary sinuses is same thing. No pain, no tenderness.
Yep, no pain.
All right, and that looks good. I'm gonna do your ears real quick as well.
Okay.
So I'm just gonna feel your pinnas. Everything looks good here. I see you have a couple piercings. Those tolerate those pretty well.
Yes, I
Okay.
do. Yep.
And everything looks good there. I don't see any abnormalities there.
Okay.
So now I'm gonna go to your eyes. So I'm gonna pull up and then have you look down, and then I'll pull down and have you look up.
Okay.
I'll do that on both sides. Okay. So look down. Okay, and look up. Okay, to this side, look down, and look up. All right. So your sclera looks good there. Your conjunctiva is nice and pink like it should be. So
Perfect.
that looks good there. And then I'm going to use my pen light.
Okay.
And I'm going to look at your pupil reactions.
Okay.
So don't look at the light, but look
Sure.
in the distance. And
Okay,
I'm gonna check
perfect.
your pupils, okay? And that looks good. And then can I have you look at the pen, and then look at my hand, and then at the pen, and then at my hand. time. Alright, so that looks good. Your pupils were nice and equal, round, reactive to light, and they were accommodating as well, so that is good.
Perfect.
So that was your cranial nerves. Just kidding. I have to do one eye test on you real quick. So I'm gonna have you follow the pen with your eyes.
Sure.
Alright, and that was your cranial nerves 3, 4, and 6.
Okay.
Do you wear any glasses or contacts or anything?
Yes, I do wear both, like glasses
Okay.
and contacts.
Do you tolerate those pretty well? You can see pretty well with those?
Yeah, my prescription's pretty low,
Okay, so based on that information, I don't have the Snellen chart to look at your cranial nerve 2, but
Okay.
based on that information, I'd say cranial nerve 2 is in function.
Perfect.
And then your 3, 4, and 6 was good as well. I'm gonna take a look at your nose real quick, okay?
Okay.
So I'm just having you look back for me. Alright, and I don't see any polyps or deviations or anything like that, so that looks good.
Mm-hmm.
And then I'm going to look in your mouth real quick as well. Alright, and then that looks good to me. Do you have any like braces or anything like that?
Yeah, I had braces
Well.
for a while, but they're off now, and that went pretty well.
Good, well, looks good.
Yeah.
I'm gonna set this to depress your tongue, and I'm gonna look at
Okay.
the back of your throat, okay?
Sure.
So just stick out your tongue and then say off, alright? Alright. Okay, so that looks nice and good. And then I'm also going to have you stick out your tongue and move it side to side. Okay, perfect. So that was your cranial nerves 10 and 12, those are intact.
Okay.
I'm going to test your swallowing real quick as well.
Sure.
So I'm going to feel for your throat real quick. Can I have you swallow? Alright, so that is your cranial nerve 9 as well, so that one's also intact.
Perfect.
And then I'm going to feel your jaw real quick. So
Okay.
have you clenched down?
Mm-hmm.
Right, and that looks good. So that is I'm going to put the edge of this fork onto places of your face. I'm gonna have you close your eyes and tell me where you feel.
Okay. Left cheek. Right cheek. Forehead. Chin. Nose.
Alright. So your cranial nerves 5 and 7 are also intact, so that is looking good today.
Perfect.
And real quick, I'm gonna check your sense of smell, so your cranial nerve 1.
Okay.
So I'm gonna have you close your eyes and tell me what you smell.
Okay.
Sorry.
Coffee.
Pretty strong, I know.
Yeah.
Sorry about that.
No, that's okay.
Alright. So now I'm going to move down to your neck, and I'm gonna feel your carotids, and I'm gonna listen to them.
Okay.
So I'm going to feel one at a time. And that feels nice and strong. And I'll feel this one. And that is nice and strong as well. So now I'm gonna listen with the bell of my stethoscope to listen for any bruise, which would be like a swishing sound.
Okay.
Alright, can I have you hold your breath real quick while I do this? Alright, and you can breathe out and then hold your breath one more time. Alright. And that is good there. I don't hear any bruise or anything abnormal, so those are looking good today.
Perfect.
And then, so we got your swallowing. I'm gonna have you turn around in the bed real quick, and
Sure.
I will assess your thyroid and then move on to your lungs.
Okay,
And
perfect.
while you're turning around, I'm gonna check my sheet once real quick.
Sure.
Okay, so I did all your vitals and checked your arms and your hands, muscle tone. Okay. Okay. And I'm going to check your thyroid real quick.
Okay.
So this is the middle of your throat. Your Adam's apple would be. I'm gonna move this over and have you swallow. Okay, that feels good. And then I'll have you move the other way and swallow. Alright, and that feels good too. So your thyroid is all good.
Okay.
Move your hair to the side.
Sure.
I'm gonna feel for chest expansion real quick.
Okay.
So just take a big deep breath in. Alright, and that was nice and symmetrical, even on both sides. Your chest diameter is a 2-to-1, which is normal, so that's good.
Okay.
And next, I'm going to listen to your lung sounds. I'm gonna move the camera over just a little bit. Okay. So each time you feel my stethoscope, I'm gonna have you take a deep breath, but we'll go nice and slow so you don't lose your breath. And
Okay.
if you need to take a breather, let me know.
Perfect.
Alright, so feeling for your scalp. I'm gonna start up here.
Okay.
Alright, moving on to the lung sound. Here's one. Okay, and moving on to 2. And 3. Okay, and that was 4. I'm just gonna come up here real quick underneath your bra.
Sure.
Okay, and that was 5, and I'll do one last spot on each side. Alright, and that sounds good. Lung sounds are clear, so that is normal. That's good.
Okay.
And then now I'm going to percuss your lungs.
Okay.
And I'm going to do 6 spots on each side, going zigzag again.
Okay.
Okay. That's 3, 4. I'm going to come up underneath.
Okay.
5. And this is 6. Alright, so that sounds nice and resonant. That's exactly what I wanted to hear, so that is good.
Okay.
And now I'm gonna have you lay down,
Okay.
and I'm gonna take the pillow away for just a minute so I can take a look at your neck.
Sure.
Alright, and can I have you turn your head away from me quickly? Alright, so I'm looking for JVD, but I do not see anything abnormal. I don't see any JVD there. I'm
Perfect.
gonna look on your other side real quick.
Okay.
And same thing there, no abnormalities there. So I
Okay.
can put your pillow back.
Perfect.
And I'm gonna hand you the camera.
Sure.
Okay. And I'm going to start by I'm gonna do your cardiac assessment. So I'm gonna feel for your lung places. I'm gonna look at the 5 places of your heart.
Okay, perfect.
So I'm gonna be listening with both the diaphragm and my bell, so that I can listen for normal heart sounds, the lub dub, and the any murmurs.
Awesome.
Okay. So first, feeling for the aortic. Here's your clavicle. First rib, first intercostal space, second rib, second space. Put the bell on my stethoscope here, or the diaphragm on my stethoscope here. Alright, and then I'm gonna flip to the bell to listen for murmurs. Alright, and nothing bad there. And now I'm gonna go to your pulmonic.
Okay.
And this is gonna be your first rib, first space, second rib, and second intercostal space for your pulmonic. Nice strong heartbeat. I'm gonna listen with my bell. Alright, and that is nice and strong. And now I'm going to look for your herbs point, which is gonna be the third intercostal space. So here's your first rib, first space, second rib, second space, third rib, and your third intercostal space. I'm gonna listen with my diaphragm. And that is a good strong beat, and listening with my bell. All right, and I don't hear any murmurs. Now I'm going to go to the fourth space for the tricuspid. Here's your first rib, first space, second rib, second space, third space. I'm gonna meet up here.
Okay.
Fourth rib, fourth space. Listening with the diaphragm. And that's good. I'm gonna turn it to my bell. Sorry. And no murmurs there. And now I'm gonna do the same thing. I'm gonna go to your fifth and listen to your mitral.
Okay.
Okay, so here is your first space, second space, third space, and fourth space, and your fifth space. We're gonna go mid-clavicular, listening with my diaphragm, and turning around to listen with my bell. And no murmurs there, so I'm going to stay here for 60 seconds to count your apical heart rate.
Okay.
All right, and that sounded good. That was your apical heart rate today was 92, so that
Okay.
is good, within normal range. And now I'm going to move to your abdominal.
Okay.
So I'm going to inspect first. So
Okay.
I see your aorta pulsating, and that looks good. I don't see any abnormal bumps or anything like that. No lesions, not anything. Is it okay if I just pull your waistband down just a little bit?
Sure. Yeah.
All right. And I'm going to first listen to each of the quadrants of your abdomen. So I'm gonna listen for bowel sounds, and with my diaphragm, the lower right quadrant. And I hear 5 bowel sounds there, so I'm moving to the upper right. All right, and I hear 5 sounds there, so I'm moving to the upper left. Okay, and 5 there too, so I'm moving to the lower left. All right, and that sounds good. And then I'm going to listen with the bell on my stethoscope for your arteries. So I'm going to listen to your aorta, which is going to be about right here. All right, and no bruise there. Renal, so your left renal artery. Right, but sorry, that was your right renal artery. This is your left renal artery. All right, and then going down to iliac. This is your left renal or left iliac artery. And your right iliac artery. Alright, and I do not hear any breeze, no swishing or anything there, so those sound good.
Perfect.
Your bowel sounds sound good as well. So I'm going to move on to percussion, if that's alright with you.
Yep.
And I'm gonna listen for 3 sounds in each quadrant.
Okay.
So I'm gonna start in your lower right. And upper right. And upper left. And lower left. Alright, and then now I'm going to percuss from your lower right quadrant and listen to for your liver border.
Okay.
Alright, and your liver border sounds good. I found that.
Perfect.
So now that I percussed, I'm going to move to light palpation. So let me know if you feel any pain or anything.
Okay.
Let's start in the lower right. Okay, that was the upper right, upper left, and lower left. All right, and that feels good, so I'm gonna go a little bit deeper.
Okay.
Do some deep palpation in your lower right, and upper right, upper left, and lower left. All right, and that feels good there.
Okay.
Now I'm going to feel for your femoral arteries.
Okay.
So I am gonna have to go just under your shorts, if that's okay.
Sure, that's fine.
Can I have you lift one of your legs for me?
Yep.
And I'm going to feel for this. Sorry about that.
No problem.
All right, and that feels good and strong. So I'm gonna listen with the bell of my stethoscope for any bruise down there.
Okay.
All right, and I do not hear any bruise there. So I'm gonna have you switch legs.
Sure.
And I'm going to feel for this one.
Okay.
All right. And good strong pulse there. And I'm gonna listen with my bell again.
Okay.
Right. All right, and that sounds good as well. No bruise there.
Okay.
Okay, and I'm going to, I can take the phone from you now.
Sure.
I believe. And I'm going to assess your legs.
Okay.
Next. Okay, real quick. Okay, and then, so we're gonna start by feeling your legs. Feel for temperature. Temperature seems nice and even. I don't see any abnormal bruising or anything like that. No scars or anything. So, looks good there. I'm gonna assess for muscle tone real quick.
Okay.
And that is nice and strong, even on both sides. So I'm gonna do a sharp and dull test on you real quick. So this is going to be sharp.
Okay.
And this is gonna be dull.
Okay.
So I'm just gonna have you close your eyes and tell me what you feel.
Sure. Sharp. Sharp. Dull. Dull. Dull.
Alright. Pass that test. Good job there. And I'm gonna feel for your pulses real quick. So first I'm gonna do your popliteal pulses. Okay, and those are nice and symmetrical. And I'm gonna listen to your listen to your post-tibial pulse.
Okay.
On the inside of your ankles.
Okay.
Right, and those are nice and symmetrical. And then I feel your dorsalis pedis. Alright, and those are symmetrical as well.
Okay.
So everything looks good there. And I'm gonna have you sit up for me.
Sure.
You can hang off the edge of the bed again. I am gonna check my sheet real quick.
Sure.
And see if I'm missing anything real quick.
Okay.
I did forget to do, I'm gonna check your range of motion real quick as
Sure.
well. Leave everything else I did. I think I'm missing too much. Okay. real quick while I'm on your legs, I'm going to do your patellar reflex real quick,
Sure.
and then I'm going to go test your range of motion in your arms.
Okay.
So I'm going to hit here, and then, okay, that looks good. All right, that was nice and strong. Okay, so real quick, I'm just going to get your, I tested the muscle tone and stuff like that, so I'm just going to test your strength and your range of motion. So I'm going to have you swim with this arm.
Okay.
Okay, nothing bad there. That felt good. No creaking or cracking.
Okay.
Okay, and I feel here. All right, and that was good. So can I have you twist your your wrist?
Yes.
Perfect. Okay, and then I'm gonna do your. I can have you go like this and push against me.
Yep.
And then I'm gonna go the other way.
Okay.
All right, now can I have you grab my hands?
Yep.
And squeeze. Perfect. Okay, and I'm gonna do the same thing on your legs real quick.
Okay.
I'm gonna push down on you.
Okay.
And then push up on you. Perfect. Can I have you do some ankle circles real quick?
Yep.
All right, and I think that looks good. I'm gonna hand you your shoes real quick,
Sure.
and then we're gonna get you up and test your gait and your cranial nerve gait.
Perfect. Oh my gosh. Okay.
All right,
Okay.
and I'm gonna have you stand up, and I'm gonna check your round break real quick.
Sure.
So I'm gonna have you stand just like this, and I'm gonna have you close your eyes, and I'm gonna just test your swing real quick.
Okay.
All right, and that looks good there. You did not have a positive round break, so your round break's negative, so you're good there.
Perfect.
So we're good to test your walking. I'm just gonna turn the camera a minute so you can
Sure.
see your walking a little better. Right, and I'm gonna have you walk towards this door.
Okay.
Okay, and then go back.
Okay.
All right, and then I'm gonna have you do the same thing but heel to toe.
Okay.
All right, so that looks good. Your cranial nerve 8 is good. Your gait and balance seems pretty good too.
Okay.
So based on everything today, you passed your head to toe. It looks good.
Perfect.
Everything's good. Your activity tolerance seems pretty well. Your nutrition is pretty good. I'm not worried about that at all. I'm not worried about any incontinence or anything for you, so it seems good. And based on your activity level, I'm not worried about friction or shear or anything.
Okay.
So I'm gonna give you a brain score of 23, which is the best you can get.
Perfect.
So you're not at a high risk for pressure ulcers at all.
Okay.
And thank you for letting me do a head to toe on you
Of
today.
course. Thank you.